Sponsor here yet, though.
All right, well, we'll get started on our speech.
Yep.
Good morning, everybody, and welcome to the Health and Human Services Committee Room. I'm going to start right off at the beginning, having our committee members introduce themselves, and I'll start this morning off to my right with Representative Daigle.
Good morning. Thank you for all being here. I'm Representative Lucian Daigle, and I represent the northern part of Maine, which is going to go to the dogs this weekend. Because the Can-Am Crown 250-mile race is going to be going on, and it's an awesome event.
Hello, everyone. I'm Sam Zager. I'm honored to represent District 116, which is part of Portland.
Good morning as the snow starts right up here. I'm Mary Ann Moore and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County, beautiful down East Maine, where it started snowing a lot earlier today. So,
Hi, I'm Michael Lemlin. I represent House District 53, which is Chelsea, Randolph, Pittston, and Dresden.
Good morning, everybody. I'm Representative Dan Shigori. I represent House District 55, the communities of Hollowell, Manchester, and West Gardner.
Good morning. My name is Julie McCabe. I represent District 93, part of Lewiston.
Good morning and welcome. I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, and parts of Kittery and South Berwick. And I'm honored to serve as this committee's House Chair.
And Representative Griffin joins us on Zoom. You want to introduce yourself?
Good morning, everyone. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levant, and Cadescade.
And I am Senator Henry Ingersoll. I represent Senate District 32, which is the wonderful city of Biddeford and the great outlying towns of Arundel, Dayton, Hollis, and Willamette. And I'm pleased to be the Senate Chair of this committee this morning. I want to introduce also Anna Broom, and our analyst, and Sophie Dubé, our clerk. Today we are scheduled to hear one bill this morning, and that is LD 335, an act to safeguard reproductive rights. I've got a little bit of a rundown of some procedure to talk about. I do want to start by talking about our sign-up sheet. There's a in support and in opposition sign-up sheet right there. We've already got one full, so feel free if you'd like to sign up. I also want to mention that if everybody could find a seat, we want to make sure that there's no standing room in here because we don't want folks standing in case we have to evacuate the room. There's a limit to how many people are here. If you cannot find a seat, we have an overflow room, which is in room 211, which is right next door in the EUT committee room. So today, the following bill is scheduled. I mentioned that already. The committee will hear testimony this morning from people present and on Zoom who wish to speak for, against, or neither for nor against the bills being heard today. With the leave of the chair, the committee members may ask clarifying questions of the people testifying today. The public hearing is just for that. It's for you, the public. The committee will have time for deliberation and debate at the work session that will be scheduled in the next few weeks. Whether you testify or not, you can submit written testimony to the committee. Please be mindful that testimony is public and available to all once presented. This hearing is live streamed and there is a recording of the meeting. Please silence all your electronic devices. If you are on Zoom, please be sure we are able to identify you when we are ready to take your testimony from you when you're attending virtually. If you're having any technical difficulties, please call our clerk Sophie at 207-287-1317. Some of our committee members serve on other committees, and you may see us coming and going this morning. You may also see committee members eating and drinking at the Horseshoe. The public is not permitted to eat, but you may drink water while you're in the committee room. We will take testimony from people in the room and on Zoom in the following order: those in support of the bill, those opposed, and those then neither for nor against. This committee will give members of the public priority when taking testimony. Only the bill sponsor and co-sponsors will be recognized before the public. We do run a 3-minute clock here on testimony. You will see the clock here in the front of the Horseshoe. As you're approaching the 3-minute point, please wrap your testimony up. If you have prepared testimony, please provide 20 copies to our clerk. You may leave those copies at the end of the Horseshoe to my left. Please sign in at the podium, and we thank you all for joining us today. With that, we'll begin the public hearing on LD 335, an act to safeguard reproductive rights, presented by the bill's sponsor, Representative Amy Kuhn of Falmouth. And there you are.
Good morning. Good morning, Senator Ingerson and Representative Meyer, and esteemed members of the Joint Standing Committee on Health and Human Services. My name is Amy Kuhn. I proudly represent House District 111 in the town of Falmouth. I am here today to present LD 335, which is an act to safeguard reproductive health care, which I'm proud to sponsor at a moment when we are witnessing unprecedented attacks on our reproductive rights and access to care. When the Dobbs case eliminated the federal constitutional right to abortion in 2022, I was proud that this legislature acted quickly and decisively to ensure that Maine law protected our reproductive rights and access to health care. In 2023, I sponsored a bill, LD 616, that prohibited insurance companies providing medical malpractice insurance from taking adverse action against healthcare professionals providing legal reproductive health care in the state, including abortion. This bill, which subsequently passed into law, was one of several bills we passed that year and in the years since to ensure that our laws are staying ahead of national attacks and protecting patients' access to essential health care. These laws have, true to our state motto, made us a leader in the fight for reproductive health care across the country. As an attorney, I'm proud of the work we've done to ensure that our state laws are as protective as possible, but I also recognize that our state laws have limits. While a national abortion ban has not yet passed, abortion opponents recognize that state abortion rights are only effective as access to care. Put bluntly, if providers are forced to close their doors, this body's hard work to shore up state laws is an empty promise. Abortion opponents are now targeting our state, and in fact all states where abortion remains legal, by attacking our healthcare providers and attempting to shut their doors. They've done this in myriad ways, most acutely through, first, defunding Maine Family Planning and Planned Parenthood in H.R. 1, preventing these organizations from being reimbursed through federal funding for care provided to Medicaid or MaineCare patients. It's a testament to these organizations' commitment to their patients that they have never stopped providing care to these patients without compensation by drawing down their reserves. Second, withholding already appropriated Title X funding, the nation's only federal funding stream for family planning and basic preventative health care services. Through this funding, was partially restored for the time being. We know that it is likely to be degraded, attacked, or withheld in the coming months and years. And I just want to clarify that those federal funds cannot be used for abortion care here in the state of Maine. Those are funds that are for preventative and primary care services. These attacks are damaging in many ways to many people across our country, but would have particularly acute impact here in Maine, where our reproductive health care network is the backbone of our fragile healthcare system and the locus for not only reproductive healthcare services, but also primary and behavioral health services as well. If we lose this network, we lose preventative care that keeps Mainers healthy, like cancer screenings, STI testing and treatment, contraceptive care, wellness exams, immunizations, and so much more. If reproductive health care centers close, many of our most vulnerable constituents will have nowhere else to go. And it's worth saying that attacks on ACA affordability and Medicaid more generally from the federal level are likely to increase demand on these providers as uninsured and underinsured patients seek out free and discounted care. When I speak of our statewide network, I'm referring not only to Maine Family Planning's 19 health centers and Planned Parenthood's 4, but also the larger Title X sub-grantee network of 32 federally qualified health centers and 8 school-based health centers, which collectively serve approximately 30,000 people per year. 69% of the patients served by this network live at 250% of poverty or below, and for 60% of those patients, their visit to a sexual or reproductive health care center is the only health care visit they will make in the course of a year. Maine's healthcare network, as you all know, is already fragile, especially in rural areas. 13 of our 16 counties are designated health provider shortage areas, with more than 85,000 Mainers living in those areas. Patients already face long waits to see providers, and many providers are already on the verge of burnout. The simple reality is that if Planned Parenthood and Maine Family Planning were to reduce healthcare center hours or close centers entirely, there would be quantifiable harm from poor birth outcomes and increased utilization of emergency rooms. So, as a lawyer, I'm concerned about the ability of our laws to safeguard Maine people in an unprecedented moment. And as a mother, I'm committed to ensuring that all of our children have access to the care they need here in Maine, regardless of shifting political winds. Everyone deserves access to the care they need. Politicians are never more qualified than patients, along with their providers, to make decisions about their health care. LD 335 is intended to protect Maine patients and their access to health care regardless of political attacks. The bill contains 3 elements that respond to immediate threats and also represent our best efforts to shield against future attacks. So first, a response to H.R. 1. The bill fills the Medicaid hole created by H.R. 1. It would substitute state dollars for federal dollars for the 1-year period providers are disqualified from federal funding in order to ensure that patients can access the care that they need. This is a policy that more than a dozen other states have already implemented or committed to, including Massachusetts, Connecticut, and Maryland. Please note that this is identical to the $2.25 million proposed by Governor Mills in her supplemental budget. Second, emergency funding streams. The bill would create safeguards in the event of a future defund or degradation of Medicaid or Title X. By requiring state funds to immediately kick in when these federal funding streams have failed, we can safeguard Maine patients from shifting political winds. Sadly, this is not idle conjecture. The Republican Study Committee has already announced its plans for permanent defund of abortion providers in the next budget reconciliation bill in Congress. Third, ongoing family planning funding. Finally, the bill would respond to requests from reproductive health care providers to sufficiently fund family planning services. This body allocated $6 million in one-time funding last year, which I understand has been a lifeline for providers during this unstable time. This bill calls for additional ongoing funding of $5 million starting in the next biennium, so July 2027, when the $6 million allocation will be fully spent down. Family planning has been flat funded for a decade, and think about how the costs of delivering healthcare have gone up in that same decade. And additional funding would address not only future political threats, but also the challenges of providing care in an environment of rising costs, substantial demand for free and discounted care, and perennial low and stagnant reimbursement rates, especially for women's health care. So, in closing, I'm proud to be a member of this legislature with our constituents have time and time again embraced our state motto, Dirigo, as we respond to the injustice, inequity, and brutality of the federal attacks on Maine. This is an opportunity for us, again, to show that Maine protects its people and what we stand for, fundamental rights, dignity, and health and well-being for all. So I would urge you to vote ought to pass on LD 335. I'm happy to answer any questions. I did, before I finish, just wanted to mention I have bills in 2 other committees this morning. I would normally not budge from this room during this public hearing. So I apologize. Please don't take offense. If I leave, I will absolutely watch the recording and be prepared to respond to anything that comes up when we get to the work session.
Thank you, Representative. Do we have any questions for the bill sponsor? Seeing none.
Thank
Thank you.
you.
We will now continue to hear testimony with those in support of the bill, starting with Lisa Margolis from PPNNE Portland.
Senator Ingerson, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Lisa Margulies. I serve as Vice President of Public Affairs, Maine for Planned Parenthood of Northern New England, and I'm here to testify in support of LD 335. PPNNE provides reproductive health care, comprehensive reproductive health care, as well as a spectrum of primary and behavioral health services. We see everyone, regardless of ability to pay, and provide millions in free and discounted care. We're often the first and only healthcare provider a patient sees in a year. Our patients and the care we provide are facing unprecedented attacks. Abortion opponents at the federal level continue to target us, including, as you heard, by withholding Title X funding and in HR 1 by barring us from federal reimbursement for Medicaid services. This has jeopardized care for tens of thousands of Mainers. It has also compounded existing threats to our financial stability, including, as you heard, rising costs to deliver care, ongoing need for free care, and stagnant and low reimbursement rates, especially for women's healthcare, which has been undervalued and undercompensated for decades. Let's be plain. These defund efforts are a backdoor abortion ban intended to eliminate access to care in states like Maine where abortion remains legal. We've fought to remain open and serve patients, but 24 Planned Parenthood health centers across the country have been forced to close. Here in Maine, we continue to welcome all patients and have refused to pass the harm to our patients, but this is not sustainable in the long term. We applaud this legislature's efforts to protect patient access, including funding approved by this committee last year that has been essential in weathering the storms. We're also thankful to the governor for her proposal to compensate providers for lost Medicaid funds during the HR 1 defund. But we know the attacks won't stop. As strong as the laws of Maine are in protecting reproductive rights, those rights mean nothing without access to care. This bill is an opportunity to protect care, not just now, but into the future. First, it would compensate providers for Medicaid services during the HR defund. Second, it would protect patients from future attacks by ensuring emergency state funding if we are barred from Medicaid or Title X. Finally, it would provide ongoing family planning funding in the next biennium. And this is a smart investment, saving $7 in Medicaid expenditures for every dollar spent. This legislature has been a fierce champion for our patients, and because of your leadership, Maine has remained a safe harbor for care. Thank you for all you do.
Thank you, Ms.
I'm
Margolis.
happy to answer questions.
Any questions? Yes. Go ahead, Representative.
Thank you, Mr. Chair. Thank you so much, Lisa. My question is that has Planned Parenthood turned anyone away if they are unable to pay for the services that they're trying to access?
Yeah, thank you. That's a really great question. No, Planned Parenthood in Maine, New Hampshire, Vermont, our affiliate has not turned anyone away for lack of ability to pay. That is a commitment that is central to our mission, and we will refuse to succumb to these federal attacks for as long as we can and ensure that everyone has access to care.
Thank you. Yes, Representative Daigle.
Thank you for presenting. I believe it was mentioned that federal funds cannot be used for abortion, correct?
Correct.
So the state funding is the sole funding used to provide abortions.
Correct. Under the Hyde Amendment, abortion cannot be funded through federal dollars except for very rare and limited circumstances. And so essentially it is not used to fund abortions. State funding already funds abortion. That was a choice this legislature chose to make in prior sessions. And so the irony of this defund is the state funding for abortion services is still happening. We are still being reimbursed for abortion services. What we're not being reimbursed for are all the other preventative care that we provide that are essential to Mainers' health and well-being.
Yes, go ahead, Representative.
The 5 million is the ask here. Isn't that even higher than what was coming from federal before HR 1? So we're actually having an increase, correct?
That's a great question. So I want to make the distinction here between the federal funding sources and then the existing holes created by years and years of undercompensated care. Just as an example of this, Medicaid, the Medicaid funding that we've lost doesn't actually cover the true cost of care. So for the Medicaid patients we serve, we are undercompensated relative to the cost of providing that care, which means we're heavily reliant on our donors, who are wonderful, as a source of funding to ensure that folks can get care. With respect to the question, particularly about the $5 million, that responds to a funding hole that has been in place for, a decade since the flat funding of family planning services. So we are responding to all of the demands and challenges that healthcare providers are responding to in this time. You know, workforce shortages, increasing cost of supplies, increasing costs for free and reduced cost care. Especially, we know that will be an issue after, you know, the ACA tax credits force people off of their insurance and people lose Medicaid. So we're responding to all that. And we're responding to the political challenges. So what I would say is, yes, that's an increase from the $1 million that's currently in the state budget for family planning, responding to existing pressures and pressures that have existed for a long time.
One more.
You said that you're underfunded for the cost of the care you're providing. What is the percentage?
The percentage of,
Like you underfunded by 10%, 20%, 30?
you know, that's a really good question. And it definitely depends on the service line. What I'll say is something that surprises many people is the service for which we are best compensated for is vasectomy care. What we know is fundamental to our healthcare system, to our society writ large, is an undervaluing and devaluing of women's and LGBTQ plus healthcare. And so, you know, what I can say is if there's more specific information requested for the work session, I can get that. You know, we run a deficit across essentially most of our service lines. And so it costs money to provide free care. And it's certainly not lucrative. And for that reason, we rely so heavily on our donor base, who has been incredible in meeting the moment, as well as on the state legislature's $6 million allocated, which I think Representative Kuhn said it, but it has been a lifesaver at this moment.
Senator Moore.
Just briefly, Lisa, do we have a copy of your testimony?
Oh, yes, it's sitting right over there. I'm
Okay.
so sorry. Great question.
Thank
I'll
you.
grab that for you
Thank you.
before I move. If there's other questions, I don't want to.
Further questions? Seeing none?
Thank you.
George Hill.
Sorry. It's like I cleared the room. Good morning, Senator Ingerson, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is George Hill. I'm the president and CEO of Maine Family Planning, and I'm here to support LD 335, an act to protect funding for family planning services. I'll do my best not to repeat points that have already been made by my predecessors. I've served as Maine Family Planning's lead staff person for 35 years, working with federal administrators, both friendly and hostile to the needs of our patients and the staff who serve them. It is an understatement to say that the attacks on our statewide family planning network over the last 13 months have never been so vindictive, nor so relentless. In many of the state's most rural areas, reproductive health care is facing enormous strain. Our severe shortage of family planning and reproductive health care providers has been exacerbated by several hospitals closing their labor and delivery units. This has led OBGYNs to leave those areas where the healthcare system is already overstrained. And although we are exploring possible partnerships with nurse midwives and doulas, these closures will inevitably have a ripple effect across the state. Patients will suffer. Last July, President Trump and his allies in Congress passed H.R. 1, a budget reconciliation bill, which excluded Maine Family Planning and Planned Parenthood of Northern New England from participating in Medicaid for the simple reason that both organizations provide abortion care. The budget law threatens the future of Maine Family Planning's rural clinics, as half of our patients rely on Medicaid. While we haven't had to close any clinics yet, the cuts made it impossible to continue providing primary care services in Holton, Ellsworth, and Presque Isle. We continue to offer the full range of sexual and reproductive health care, regardless of ability to pay. Ending primary care in those three clinics last October affected 1,000 primary care patients, all of them living in federally designated medically underserved areas. In 2025, Maine's legislature approved one-time funding for Maine's Family Planning Network. On behalf of the 30,000 patients served by Maine's network of providers, we thank you. It proved to be essential in stabilizing the network's healthcare operations. But with the Affordable Care Act, insurance subsidies just expiring, Mainers facing increasing financial pressures generally, and many people who will lose their insurance in November through Medicaid, we expect many will turn to Maine Family Planning clinics. And while we continue to serve Medicaid insured patients at no cost to them, as Lisa said, that's clearly unsustainable over time. Simply put, our patients need federal funding to be replaced by state funding on an ongoing basis to prevent clinic closures and layoffs. A more robust state partnership in funding essential healthcare has been needed for decades. By entering into such a partnership, the legislature can protect critical access to the wide range of services the state's family planning network provides to 30,000 folks every year. We encourage you to seize the opportunity as a critically important investment in Maine's public health. Thank you. I'll take questions if you have any.
Thank you, Mr. Hell, for being here.
All done?
Any questions? Seeing none.
Okay.
Thank you.
Thank you very much.
Dr. Anne Marie Van, I believe it's Hugh.
Hagel.
Hagel?
Hagel.
Hagel. All right.
Good morning. Senator Ingerson, Representative Myers, and members of the Joint Standing Committee on Health and Human Services. My name is Anne Marie Van Hengel. I'm a resident of Portland, a board-certified OBGYN, and I've practiced in Maine for over 30 years. I now focus my work on perinatal advocacy. I'm here today on behalf of the Maine section of the American College of Obstetricians and Gynecologists, representing 186 members statewide. As practicing OBGYNs committed to providing patient-centered, evidence-based care, the Maine section of ACOG strongly endorses LD 335, an act to protect funding for family planning services. Maine's sexual and reproductive health provider network continues to provide safe, affordable, and essential primary and behavioral health services to thousands of Mainers, despite the targeted federal actions implemented under H.R. 1. This federal policy prohibits reimbursement for essential health services simply because a provider also provides abortion care. It is clear that living in Maine, where our laws protect reproductive health care, does not insulate our patients from the far-reaching ripple effects of restrictive federal policies. Thousands of Mainers rely on these providers for cancer screenings, routine gynecologic care, contraception, screening, testing, and treatment of sexually transmitted infections and behavioral health concerns. For many, these clinics are their only source of care. As destabilizing federal cuts to publicly funded services take effect, health inequities in Maine will deepen, particularly in rural communities where access is already fragile. The provisions of LD 335 will allow for uninterrupted delivery of reproductive health services of Mainers and establish emergency state funding mechanisms in the likely setting of further federal attempts to defund providers. Finally, it earmarks consistent yearly funding for family planning services, replacing the unsustainable instability of one-time appropriations with predictable support. To understand why this matters, it's important to recognize that sexual reproductive health care is inextricably linked to full spectrum OBGYN care. Restrictions on reproductive health services, including abortion, have broader and measurable consequences. Increases in unintended teen pregnancies, worsening maternal and infant outcomes, increased spread of sexually transmitted infections, and missed or delayed cancer diagnoses. These health outcomes carry significant economic and societal costs that affect all of us. LD 335 is not about ideology. It's about sustaining a functional and equitable healthcare infrastructure in Maine. ACOG firmly believes that the full array of evidence-based reproductive health services must remain available and affordable without financial or political barriers. For these reasons, Maine ACOG respectfully urges you to vote ought to pass for LD 335. Happy to answer any questions.
Thank you, Doctor. Do you have any questions? Seeing none.
Great.
Thank you. Meredith Ruxton McIntosh.
Morning. Thank you, Senator Ingerson and Representative Meyer and the members of the Committee on Health and Human Services. I'm Meredith Rexton McIntosh. I live in Hollowell, and I'm here to testify in support of LD 335, the state level funding bill. I was 16 on my first visit to Planned Parenthood, though I wish it had been sooner. I didn't have anyone that would talk to me about how my body worked or why things happened the way they did. My parents literally handed me a dictionary when I asked questions. The lack of information left me vulnerable to people taking advantage of my ignorance. After overhearing a classmate talking about healthcare she received at Planned Parenthood, I looked them up in the Yellow Pages. It was 1986. No internet back then. I didn't have a car or anyone that could take me to the appointment, so I had to skip school and take the bus for over an hour to attend an appointment that I had to wait for over a month. A closer and or more robustly staffed facility would have been immensely beneficial in receiving the care in a more timely manner. I continued to rely on Planned Parenthood over the next 25 years for a variety of medical needs in different cities and states, knowing that I could trust them. Planned Parenthood and the medical providers they referred me to have saved my life several times through compassion, basic medical care, reproductive health, and recognizing the signs of domestic abuse. They provided the information and vital resources needed for me to make informed decisions. Without the medical care and counseling that I was able to access through Planned Parenthood, I would have likely dropped out of high school, never joined the military, never attended college or trade school, and most certainly would have indulged in addictive substances to the detriment of my life. Members of the committee, I'm asking you, please vote to pass LD 335. Thank you for your time and opportunity for my testimony.
Do we have any questions? Seeing none. Cassie Sparrow Shoot.
Good morning. My name is Cassie Sparrow-Shute, and thank you for allowing me to speak. Senator Ingerson, Representative Meyer. So I am a high-risk mom. I lost twins at 20 weeks and then had to fight to have my daughter. I realized how important reproductive care was as a result of my experiences. Ended up becoming an educator, put myself through grad school, got a master's degree in secondary ed. And as a result, first and foremost, the work that you have done to support family planning in the last year is something I'm deeply grateful for myself, for my daughter. The work you've done to help allow for public education, for treating outbreaks. This is absolutely fantastic. And I know as now I'm approaching perimenopause, I can get help from Planned Parenthood. And these are the reasons that we come before you and ask, please continue to support family planning through LD 335. I need it. My daughter needs it. Students need it. And we absolutely need the continued support. And it is with deep gratitude seeing what you've done before and knowing that we can keep going forward with your help and your continued allyship and dedication to science. So please vote on LD 335. Thank you.
Thank you for your testimony this morning, Ms. Shute. Any questions? Seeing none. Amy Partridge Barber? Or might be Barker? Barber. Okay, thanks.
Morning. Senator Ingerson, Representative Meyer, and members of the Standing Committee on Health and Human Services. I'm Amy Partridge Barber, a resident of Carrabassett Valley, and I'm here to urge you to vote ought to pass on LD 335. You're going to hear many stories today about the difference Planned Parenthood has made in people's lives. I'm here to remind you about what life looks like without Planned Parenthood. When I was a teenager, in the 1980s, abortion was legal and Planned Parenthood was easily accessible to me for birth control and questions about STIs. For most of my life, I took access to reproductive health care for granted. Then while in Chicago, I saw an art exhibit I'll never forget. The gallery walls were covered floor to ceiling with thousands of letters written to the Army of Three in California in the 1960s by women and their partners seeking help to access safe abortions. These were good people in hard situations. They turned to a small group of women, and maybe there were a few men in there, but mostly women, the 7 were women, whose goal was to save lives before 1973, when Roe v. Wade made abortion legal. I was frozen in place reading these letters because this is when it hit me. My mother could have easily been up on that wall. In 1967, my unmarried mother became pregnant with my sister. In 1968, there was a fast wedding and an unexpected baby. My sister ended up having a chromosomal disorder and would spend the rest of her life needing 24/7 care. 3 years later, my mom became pregnant with me. Before your mind slips into judgment, my mom was not promiscuous or irresponsible. Both pregnancies were the result of an IUD which failed to prevent pregnancy. My mom was not ready to be a mom. She certainly was not ready to mother a disabled child. And when I came along, she had little left to give. My sister has spent most of her life being cared for by the women of the Roman Catholic Church. For the past 25 years, she has been mothered by a woman who gets paid $20 an hour to care for her. I am grateful beyond words for the people who have come together to love my sister and give her a good life. And it has not been easy for any of them, including my mother and my sister. If abortion had been legal in 1967 and Planned Parenthood had been accessible to my mother, I assure you she would have terminated her first pregnancy. Odds are this would have allowed her to go to college, marry someone she loved, and have a child when she was ready to mother. I once told my mom that she did the best she could with what she had. Her response to me was, "I don't remember any of it. It was just too hard." To this day, my mom can barely speak about any of this with her words, but her body tells the tale. She has autoimmune disease, heart disease, and she is full of rage and shame. Do I wish my sister had never been born? No. I love her and she loves me and she is my family. Do I wish I had never been born? No. At 17, I got myself out of a neglectful and abusive home. I have created a safe and happy life, and I have spent my entire adult life devoted to preventing child abuse and helping people recover from child abuse as a clinical social worker for 32 years. I am a living, breathing example of what a world without access to Planned Parenthood looks like. So I'm here to urge you to vote ought to pass on LD 335.
Thank you so much for your testimony. Any questions? Seeing none. Sarah Waite?
Morning. I forgot my glasses, so I'm going to muddle through this one. Good morning, Senator Ingerson, Senator Meyer, and members of the Committee of the Health and Human Services. I'm Sarah Waite, and I live in Denmark, Maine. I urge you to vote ought to pass on LD 335. I'd like to share my story with you. In my first semester of college, I was 17, naive and green. I grew up in a household where the unmentionables, sex, birth control, and reproductive health were, in fact, never mentioned. I was a young girl with a Dorothy Hamill haircut, pink and green whale pants, suddenly dropped into the freedom of campus life in the middle of West Virginia. With that freedom, I experimented, but I lacked the toolkit to navigate it. I didn't know the resources that, like Planned Parenthood, existed to help me prevent a pregnancy. I only found out about the difficulties of navigating that reproductive health care system when I found myself staring at a positive test. I had just turned 18. I was petrified and deeply ashamed. Planned Parenthood was the first place that replaced my fear with information. They didn't just provide medical service, they provided me education. They ensured that I was supported, offered me counseling, and perhaps most importantly, reminded me that I was not alone. I often think about what would have happened to that 18-year-old girl if Planned Parenthood had not been there. I'm incredibly fortunate that I never had to find out. Every woman, girl, and mother deserves that same chance. They deserve a chance to have a choice, the access to birth control, and the right to health care that fits their life and their needs. I'm sharing my story because silence is what led me to my experience. I believe that speaking out is what will protect the choices of those that come after me. I urge you, please vote ought to pass LD 335. Thank you.
Thank you so much. Any questions? Seeing none. Lily James? You skipped her.
Good morning. I have copies that I will submit online afterwards. I apologize for not having written for you today. Good morning, Chair Ingerson, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Lily Bowen James. I'm the Advocacy Director at the Maine Women's Lobby, which for almost 50 years has worked to build gender justice in Maine through legislative advocacy and systems change. We are here today in support of LD 335 and thank Representative Kuhn for sponsoring this important bill. As you've heard, the statewide network of Maine Family Planning and Planned Parenthood of Northern New England clinics provide the sexual health and primary care safety net across our state, serving tens of thousands of Mainers each year. While reproductive health care and abortion remains legal in Maine due to robust state laws, Mainers' ability to exercise their right to a comprehensive reproductive health care is being restricted in practice through a federal level targeted defunding of providers. In July 2025, Congress Budget Bill H.R. 1 included a one-year ban on reproductive health care providers who offer abortion care receiving federal Medicaid reimbursement for non-abortion services, including birth control, cancer screenings, and other life-saving care. As you've heard, the impacts of this policy have already been felt. Maine Family Planning has ended primary care in 3 locations, and since 2025, nearly 50 Planned Parenthood affiliated health centers nationwide have closed. Each closure widens disparities in access to abortion and reproductive health care, particularly for rural communities and people without the means to travel long distances. A stable statewide network of reproductive health care providers is essential to ensuring that access is not determined by zip code. This is especially true in Maine, one of the most rural states in the country, where many communities already face care shortages. When even one clinic reduces services or closes, the impact reverberates across entire regions, forcing patients to travel hours for care, delaying time-sensitive services like abortion, or foregoing care altogether. Sustained and reliable state investment is critical to maintaining a geographically distributed network that ensures people in rural and underserved communities can access reproductive health care close to home safely and without undue burden. LD 335 is a critical and timely response. It would help ensure that the right to reproductive health care, including abortion, is not merely protected in statute, but accessible in reality, especially for those most impacted by systemic inequalities. Reproductive freedom is inseparable from racial justice, economic justice, and gender justice. And LD 335 affirms Maine's commitments to bodily autonomy, medical integrity, and the dignity of all people, especially those who have historically been denied equitable care. We urge the committee to vote ought to pass. I'm happy to answer any questions.
Thank you so much for your testimony and for being on time. That's great. Any questions for Ms. James? Seeing none.
Thank you.
Dr. Connie Adler. Dr. Adler, my apologies.
That's okay.
Accidentally skipped over
I thought
you.
you didn't like me. Fine. No problem. Senator Ingerson, Representative Meyer, and members of the Committee on Health and Human Services. My name is Dr. Connie Adler, as you heard. I provided primary care, primarily women's health care, for almost 30 years in Farmington. I am speaking in favor of LD 335 on behalf of the Maine Medical Association and the Maine Osteopathic Association. We all know that primary care and rural health care are under enormous stress in Maine. Anyone who doesn't have a primary care provider, has moved to a new town, or just graduated from pediatric care can have experienced the struggle of signing up with a new healthcare clinician and then having to wait 4 to 6 months to actually get an appointment to be seen. By then, if you're of reproductive age, you could already be pregnant because you didn't get contraception. You can already have a sexually transmitted disease, which could make you unable to get pregnant later when you want to, or even kill you in the case of some of them. Or you could have suffered 6 months of pain that you didn't understand and didn't know how to take care of. Reproductive and sexual health care clinics, such as Maine Family Planning, are an essential part of the medical system in this state. I don't think that's true in every state, but it's definitely true in Maine, especially at a time when primary care providers are overwhelmed and not always available. In addition to wait times, of course, there is the cost of healthcare. Many people, especially young people, do not have health insurance that will pay for STI treatment, contraception, etc. And having a clinic like Maine Family Planning in many communities in Maine, especially smaller towns, Ellsworth, other towns that size, having a clinic in these communities means the difference between good care and no care at all. While in a very busy practice, I also served on the board of directors of Maine Family Planning on and off for almost 20 years. I saw George Hill a lot, and chaired their clinical advisory council. I did that because I knew how important its existence was for the people in my community and the state. I did it so that I could tell people how much I trusted the quality of care at Maine Family Planning sites. And I did it because I believe everyone deserves excellent health care, regardless of their ability to pay. On behalf of Maine physicians, I strongly urge the legislature to support the people of Maine by providing financial assistance through LD 335. I am happy to answer any questions.
Thank you, Dr. Adler. Do we have any questions? Seeing none. Laura Harper.
Good morning, Senator Ingerson, Representative Meyer, members of the committee. My name is Laura Harper. I live in Hollowell. I'm a senior associate at Mooseridge Associates, and I'm testifying before you today on behalf of my client, the Maine Academy of Physician Associates, or MEPA. In 1977, MEPA was incorporated as a nonprofit organization to represent physician associates, or PAs, employed within the state of Maine. The PA profession originated in the 1960s at a time when the U.S. was experiencing a progressive shortage of physicians, particularly in primary care. The goal was to rapidly train and deploy safe and competent clinicians to help address physician shortages and increase access to quality health care. Today, UNE, Maine's only PA program focused on rural primary care, graduates approximately 50 students per year, with 70% of them remaining in Maine to practice. There are more than 1,100 PAs practicing in Maine. Per our national affiliate's annual salary report, 31.4% of Maine PAs work in primary care, and 34% of all Maine PAs practice in rural locations. PAs in primary care in particular are essential to expand access to care for Mainers. Many patients in remote locations rely exclusively on PAs to deliver their care, where access to physician-delivered primary care ranges from reduced to non-existent. PAs in Maine and across the country continue to fill the physician shortage gap to this day and function alongside our physician colleagues as leaders in the interdisciplinary healthcare team. First and foremost, MEPA stands united with our colleagues who provide life-saving sexual and reproductive health care as part of Maine's statewide family planning network.
Because of our history and our training, PAs play a unique role as clinicians in helping to address access to quality and affordability during this time of crisis and turmoil in the healthcare system as a whole. We see ourselves as partners alongside physicians, nurses, and all healthcare professionals when it comes to ensuring all Mainers have access to the care they need when they need it and close to home. Therefore, it is no surprise that we are in strong support of this bill. This bill protects access to not only sexual and reproductive care, but also primary and behavioral health services. Often, family planning providers are the first and only healthcare clinician a patient will see annually. They are on the front lines, screening not only for cancers and STIs, but also depression and intimate partner violence. Maine Family Planning and Planned Parenthood in Maine provide care to anyone who needs them, regardless of ability to pay, and subsequently provide millions of dollars in free and discounted care each year. They are part of the backbone of Maine's healthcare system, especially in our most rural communities, and they deserve our support. Access to reproductive health care is critical to protect an individual's physical and mental well-being, and it is in the best interest of broader public health. LD 335 will provide much-needed protection for Maine patients and ensure access can continue for the essential health care Maine's family planning providers offer. As we continue to see actions escalate nationally to penalize clinicians and erode access to all sexual and reproductive care, we urge you to take action now and support this legislation. Thank you so much.
Thank you for your testimony this morning, Ms. Harper. Do we have any questions? Yes, Representative Lemlin.
Thank you, Senator. Good morning.
Good morning.
In 2025, how many women used family planning services that you're talking about?
I don't know the answer to that question, but I will attempt to find it for you.
I would really appreciate that. Thank you.
Okay.
Further questions? Seeing none. Thank you.
Thank you.
Heidi Lester.
Good morning, Senator Ingwerson, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Heidi Lester. I use they, them pronouns, and I am the Deputy Director of Equality Maine, which has been advocating on behalf of Maine's LGBTQ plus community since 1984. We strongly support LD 335 and believe it is essential to ensure that adequate funding is available for the providers that thousands of people around the state, including LGBTQ plus people, rely on for their care. Of the nearly 30,000 patients who receive services each year through more than 60 healthcare sites statewide, over 80% qualify for free or reduced cost care. Many of these sites are rural, and often family planning clinicians are the only medical providers patients see in a year. Thousands of Mainers rely on family planning providers for many types of health care, including but not limited to primary care, pregnancy services, cancer screenings, mental and behavioral services, screening for diabetes, and sexually transmitted infections, testing, and treatment. It is also important to note that family planning providers connect patients with essential social services and agencies that cover other basic needs like food and housing. Meanwhile, these providers are also contending with the increasing costs of delivering care, growing demand for free and reduced care, insufficient reimbursement rates, and ongoing political attacks. Additionally, Maine is experiencing an active HIV cluster and skyrocketing rates of sexually transmitted infections, and family planning providers are among those who have been working tirelessly to ensure everyone has access to testing, prevention, and treatment. The case for funding of family planning services is clear. The availability of services substantially improves the educational, economic, and overall well-being of recipients, their families, and society as a whole, and yields cost savings for the healthcare system at large. We ask you to vote to pass on LD 335 in order to ensure that everyone has access to essential health care. As health providers are serving more patients than ever without sufficient support, there has never been a more critical time to invest in Maine's family planning network. Thank you.
And thank you for being here for your testimony this morning. Any questions? Seeing none. Lonnie Graham?
Senator Ingerson, Representative Meyer, and members of the Health and Human Services Committee. My name is Lonnie Graham. I'm a physician from Freeport in support of LD 335. In 1990, when I was public health director, Maine's teen birth rate was approximately 24 births per 1,000, ages 15 to 19. I immediately committed myself to supporting family planning services. That commitment brings me here today. By 2023, Maine's high rate of teen pregnancy had descended to about 7 per 1,000, nearly a 70% reduction. That achievement was not accidental. It reflects sustained access to family planning services supported by multiple administrations and thousands of Mainers over decades. In addition to supporting healthier and happier families, family planning services consistently save more money than they cost, which is not true of most health services. For every public dollar invested in family planning, $7 are saved in pregnancy, delivery, and infant care costs. Family planning is one of the few health services where states often see budgetary return within 1 to 2 fiscal cycles. And these services are not just for teens. They are essential for women across the lifespan, including older women who rely on them for cancer screening, preventive care, and chronic health conditions. For many low-income or uninsured women in Maine, publicly supported reproductive health providers are their primary and sometimes their only point of contact with the healthcare system. In rural states like Maine, where transportation barriers, workforce shortages, and aging demographics intersect, preserving access points is especially critical. Preventive services delivered in community-based reproductive health centers are part of our cancer control strategy. Weakening these services would disproportionately affect older women who are widowed, living alone, or managing on fixed incomes, precisely those least able to support the gaps in care. Many counties lack local obstetrical services. Some family planning sites have reduced hours or closed services altogether. When even one clinic disappears in rural Maine, access is not reduced, it's effectively eliminated for many women. Federal planning financial support has essentially disappeared. LD 335 asks whether Maine will ensure continuity of those critical public health services. Prevention works, but only when it's accessible. Let's make sure that continues. Thank you for your attention.
Thank you, Dr. Graham, for your testimony. We have questions. Yes, Representative Lemlin.
Thank you, Senator. Hi, Doctor. Do you know what the birth rate is in the state of Maine right now?
Currently, I don't, but I'm sure others here do.
Okay, it's 1.4, and we need 2.1 in order to sustain ourselves as a state. That's a documented fact. So how would this bill help us go from 1.4 to 2.1? In your testimony, you're saying that you're happy that the teen pregnancy went from 7 per down to 7 per 1,000, 70% reduction. That's counterproductive to what we need here in Maine. So how is this bill going to help us get to 2.1? Do you know?
Well, I don't think necessarily it's counterproductive because children who become mothers are not the best mothers that we have. And so in order to appropriately space your family, this is what family planning services do. Their purpose is not to eliminate pregnancy, it's to reduce it when women or girls are not prepared to become mothers. So I guess I think it's still a good thing.
But it is counterproductive to what we need to do here in the state of Maine, which is get
Well,
it from 1.4 to 2.1. And not all the pregnancies are about children. Matter of fact, there's not that many.
Well, there are other answers, I think, to that question. We may see things differently.
Further questions? Seeing none, thanks so much for being here. Alex Carter.
Good morning, Senator Ingwerson and members of the Health and Human Services Committee. My name is Alex Carter. I'm a senior policy advocate at Maine Equal Justice, a nonprofit civil legal aid provider working to increase economic security, opportunity, and equity for people in Maine. Through direct legal services and systemic advocacy, we represent the interests of people with low income across our state. Maine's Family Planning Network consists of 63 health centers statewide and provides care to anyone who needs it, regardless of their ability to pay or their insurance status. For many Mainers with low income, reproductive health centers are essential points of access to primary and sexual and reproductive health services. They are trusted sources of knowledge, confidential counseling, and sensitive health care, and many times the closest and most flexible option for people who face financial and logistical barriers to access. And on a personal note, I actually received primary care from a reproductive health center when I first moved back to Maine because I had a very hard time finding a provider and I was uninsured for a short amount of time. And so Maine's reproductive health centers really represent the definition of a safety net provider. The majority of their patients, about 69%, live at or below 250% of the federal poverty level or make under $40,000 annually. Nearly half of Maine Family Planning's patients are currently insured through Medicaid, while 22% lack insurance altogether. At PPNNE health centers, 24% of patients use Medicaid, 68% qualify for Title X services, and 58% are considered low income. As you've already heard, today, Congress passed H.R. 1 in July and some of the most sweeping changes to Medicaid in the history of the program. This included new work reporting requirements, further restrictions on immigrant eligibility, and a one-year prohibition on federal Medicaid reimbursements for providers who offer abortion care. This means half of Maine Family Planning's patients and nearly a quarter of Planned Parenthood patients cannot use their insurance at their preferred provider. It also means our family planning clinics are providing exponentially more uncompensated care at an unsustainable level. Without state support, we will see more cuts to services, more clinic closures, and more people going without necessary care. Those impacts will fall hardest on people who are already most marginalized by our healthcare system, people with low income, young people, trans people, immigrants, and people in rural and underserved parts of our state. LD 335 seeks to offset the losses from HR 1 and protections in place to safeguard against possible future attacks on Medicaid and Title X funding. Ensuring the sustainability of our family planning network supports the health and well-being of all Mainers, and I urge your support for LD 335 today. Thank you.
Thank you so much for your testimony. Have any questions? Seeing none. Ash Northey.
Senator Ingwerson, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Ash Northey, and I'm the policy coordinator at OutMaine. For over 30 years, we have dedicated ourselves to providing programming, services, and support for LGBTQ youth and their families. And we are in strong support of LD 335. Every day, we work with young people who are doing their best to grow, learn, and build healthy futures. Many of them live in the most rural communities in Maine and are navigating poverty, housing instability, and other barriers to care. For many of the young people we serve, family planning providers are not just clinics, they are safe spaces. They are places where young people can ask questions without fear, receive medically accurate information, and access essential health services with dignity and respect. For LGBTQ teens, these services are life-saving. In Maine, access to comprehensive health care has long been a bipartisan value, grounded in public health, personal responsibility, and care for our neighbors. When funding for healthcare is threatened or destabilized, it is always the most vulnerable communities that feel it first. This bill ensures that Maine can protect and preserve funding streams for family planning services regardless of shifting federal priorities. This stability allows providers to retain staff, keep rural clinics open, invest in outreach, and continue offering sliding scale services to those who need them most. Bottom line, it's about health equity. On behalf of the young people we serve, I respectfully urge you to vote ought to pass on LD 335 and continue to protect healthcare coverage for all Mainers, including LGBTQ youth. Thank you.
Thank you for your testimony this morning. Any questions? Seeing none. I think we've already had Cassandra Sparrow-Chute come up.
Yes.
Okay.
Yes, sir.
Ashley Smith.
Good morning. Hello, Senator and honorable members of the committee. My name is Ashley Smith, and I'm a resident of Belgrade, present to urge you to support LD 335. While Maine has laws in place to protect the right to access an array of reproductive health care, the federal funding allocated to these professionals is inadequate. For nearly 6 decades, Title X organizations have provided access to preventative care for individuals who are uninsured, have low incomes, and to communities in the most rural parts of our state. In order to continue to provide these necessary resources to individuals and communities, we must seek additional funding from the state. My personal testimony begins when I was seeking care 6 years ago. It was in the winter of 2020, and I had been furloughed from my job twice in 1 calendar year. I lived alone in an apartment, uninsured, financially insecure, and in need of medical care. I was fortunate to learn about Maine Family Planning, who offered me an income-based sliding scale payment option for my visit. Imagine how it felt when the financial barrier was removed and I now had access to quality and compassionate care. Care that would provide me with life-saving cancer screenings, mammogram referrals, as well as a diagnosis and effective treatment of a chronic disorder that radically changed my life. The flat funding of these organizations is a constant threat to their existence. And if these Title X clinics cease to exist, it would have a profound impact on our state's public health. With increasing inflation and the rising cost of nearly everything in our lives, more and more people like me will be forced to decide what is of more value to them: health and well-being, or food and shelter. The politicizing and perpetual insufficient funding of these clinics is such a demoralizing way of telling your most marginalized and vulnerable constituents that they are not worthy of receiving basic health care. And that is why I call upon you to support LD 335, because I believe that all Mainers deserve the resources and accessibility to make sustainable decisions about their health care. And the recipients of this funding provide exactly that. They provide client-centered, high-quality, and economical care for our Maine communities and individuals that deserve it the most. Thank you for the opportunity to share my perspective. I urge you to support LD 335. Any questions?
Thank you, Ashley. Any questions from the committee? I'm seeing
Thank you
none.
so much.
Appreciate you being here. I feel like we've already heard from Amy Partridge Barber. Okay. Do we have Sheldon Hussier?
Yes.
I'm sure. She's out by the information desk. How badly did I mispronounce your last name?
Not bad. Hussier.
Hussier. Welcome.
Thank you. Senator Ingerson, Representative Meyer, and esteemed members of the Committee on Health and Human Services. I'm here today in support of LD 335, an act to safeguard reproductive rights. My name is Sheldon, proud dad of a 13-year-old, and I'm here to speak up not just for her, but for all the children and young adults of Maine that rely on neighborhood clinics that LD 335 would support. Maine has a lot of young adults who live down dirt roads, an hour or so from the nearest hospital. These are kids whose parents are working double shifts just to keep the heat on, and who cannot afford to miss a day's pay to drive 2 hours round trip to a doctor's appointment. LD 335 isn't about politics. It's about the knot I feel in my stomach when I think about those kids. It's about the 14-year-old girl on my daughter's softball team who has no one to talk to about the crushing anxiety because the only available counselors are booked out for months. It's about the quiet kid in their class whose parents cannot get the time off for the annual checkup, so a sports physical gets missed and an undiagnosed heart murmur gets missed. The Maine Family Planning and Planned Parenthood clinics supported by this bill are the only lifeline for these young adults. They are the places where kids can walk in and get a simple strep test without their parents losing a day's wages. They are where a young woman can get her first cancer screening, or a young man can get help for depression before it spirals. These are the front line of defense for the most basic healthcare needs. When we force rural clinics to close their doors, we're not just closing buildings. We are telling our young people that their health, their future does not matter. We create a generation growing up believing that pain and sickness are just something you have to endure alone. That breeds hopelessness. And a hopeless kid, a sick kid, they can't focus in school. They cannot dream about the future. The ripple effects are felt in every classroom, on every town corner, and in every business. I stand here desperate because I see the barriers my daughter's friends face every day. I also stand here hopeful because you have the power to tear those barriers down. By supporting this bill, you are telling every kid in our rural communities that they are seen, that they are valued, and their health matters as much as any kid in Portland or Bangor. Please give them that hope. Support LD 335. Thank you.
Thank you for being here today. Questions from the committee? I'm seeing none. Sarah Waite. She already went. Okay. Betsy Williams.
Good morning, Representative Meyer and Senator Ingersoll and members of the Health and Human Services Committee. My name is Betsy Williams. I live in Brunswick, and I am the chairperson of the Maine Unitarian Universalist State Action Network, linking over 400 individuals and 18 congregations in working for public policies that center our core religious values and principles. Last year, I testified before this committee on funding family planning services, and I am so grateful for the vote you took and the outcome of that bill. Sadly, the funding secured is insufficient in the face of federal actions, and I'm returning to this committee today to make the same argument for LD 335. And here it is. Not all people of faith are opposed to protecting reproductive rights. In fact, most people of faith in both Western and Eastern religions follow a fundamental commandment, if you will, to love one's neighbor as oneself. In practice, this means standing up and speaking up when the basic rights and protections of our most vulnerable citizens are threatened. LD 335 addresses such a threat by prioritizing the funding necessary to provide essential services to women who are otherwise unable to access them. Without preventive and annual exams and screenings, people are vulnerable to a host of treatable illnesses, including cervical cancer, HIV, and STIs. Without family planning services, men, women, and children are all vulnerable to greater economic hardship due to untreated illness and unplanned pregnancies. Every woman in Maine deserves to be given the opportunity for a healthy life. Every woman in Maine deserves to be treated with the same respect you would treat the women in your own lives. Love your neighbor as yourself. Please do not abandon Maine's most vulnerable families. Vote ought to pass on LD 335 and use the power that only you, our state legislators, have to assure that funding these services will continue. Thank you.
Thank you for being here today. Questions from the committee? I'm seeing none. Brianna Keefe. Is it Odes?
Thank you. Hi. Senator Ingersoll, Representative Meyer, members of the Committee on Health and Human Services. My name is Brianna Keefe Oates. I'm a reproductive epidemiologist, and I'm the principal investigator of a study to understand the impacts of federal funding changes on access to contraceptive care throughout the United States.
This study is in collaboration with Maine Family Planning and several other partners nationwide. It's really just begun, so we'll have more data later, but I have a few results about appointment availability today that I think would be relevant to this hearing. As part of this study, we used what we call a mystery shopper methodology. So we called a total of 93 clinics in Maine, federally qualified health centers, FQHCs, and family planning clinics. So these are clinics that can support people who are uninsured or underinsured. We called as if we were patients, and we asked how quickly we could get an appointment as a new patient who wanted to access contraceptive care. Now, we asked about contraception because that's the focus of our study, but I think this applies kind of broadly to appointments for new patients for sexual and reproductive health services. In Maine, we found that family planning clinics are able to rapidly see patients for these really important and time-sensitive appointments, while FQHCs will take longer. And we've already heard, they simply already have so many established patients that they are already seeing for a range of primary care services. Among family planning clinics, 88% were able to see a new patient within a week. And all family planning clinics could see a new patient within 12 weeks. This is compared to only 7% of FQHCs who could see a new patient within a week, and 76% who could see a patient within 12 weeks. Now, I just want to be clear, FQHCs serve an incredibly important purpose, as I'm sure you all know. And they're part of the family planning network. Many of them, they also provide sexual and reproductive health care services. But I think these data illustrate that many FQHCs are already at or near capacity. There were also a numerous percentage who just simply weren't accepting patients. So when we think about patients who don't already have primary care, right? They're perhaps recently lost insurance, can't go to the primary care they were seeing. There isn't a primary care clinic nearby. For those patients who need really time-sensitive care, like birth control or an STI test, they can't wait weeks to months. If family planning clinics were to close, we would likely see an even more enormous strain on those primary care providers in the state, which we already know are strained. And we would likely see patients just unable to access this critical care, which would result in kind of public health impacts that others have discussed. And I'm happy to provide more information on the study. I ran out of printing ink because I was trying to print that pretty figure right there, but happy to provide more information later. Thank you.
Well, thank you for being here today. Questions from the committee? Yes, Representative Zager.
Thank you, Madam Chair. Appreciate the testimony and the data. Is this published anywhere yet?
Not yet. We literally finished those calls at the end of January and are analyzing them as we speak, but we're hoping to put out a report quickly, and we'll be continuing the study for 2 years, so we'll be able to track changes.
Great. If you do have any even unpublished manuscript that you would feel comfortable sharing, be interested to see that.
Yeah, we can share more reports. Kind of a report, again, not a manuscript yet because we're still working on it, but we can share more data, certainly.
Thank you.
Seeing no other questions, appreciate you being here today. Oh, go ahead. Sorry.
You called abortion contraception care. Is that a correct definition?
I was actually referring to contraceptive care, so things that prevent pregnancy like birth control and IUDs. Mm-hmm.
Okay.
Yep. Thank you for being here today. I know we've already heard from George. Melissa Gray. Welcome.
Good morning, Senator Ingerson, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Melissa Gray, and I'm the Clinical Services Director at Maine Family Planning, MFP. I'm here to support LD 335, an act to protect funding for family planning services. Our largely rural environment is a real stressor in Maine. Maine Family Planning and the state's reproductive care network of 63 sites have long played a key role in alleviating barriers to healthcare access. In July 2025, Trump and his allies in Congress passed a budget bill, H.R. 1, that prohibits reproductive healthcare providers like us who offer abortion care from being reimbursed with federal Medicaid funding. That includes funding for non-abortion services. We have relied every year on $2 million in federal Medicaid funds to serve patients with low incomes who see us as their trusted healthcare provider. Those funds represent 20% of our overall budget. Half of our patients are on Medicaid, known as Maine Care. This sudden funding cut was a direct attack on our most vulnerable Mainers. We had the extremely difficult decision to slim down some of our services, ending our primary care services in Holden, Presque Isle, and Ellsworth in October of last year. Patients were upset, confused, and disappointed. Discharging and turning away vulnerable patients strikes at the very heart of Maine Family Planning's reputation as a trusted community provider. Those in rural communities have very few care options. Even patients who may be able to travel and access care face further delays, further travel, and longer wait times. It's higher costs in Maine's already overstretched healthcare system. At Maine Family Planning, we provide essential health care to everyone, regardless of their ability to pay. We often are patients' last resort for care. It's deeply troubling to think about where our patients are going to go if we are no longer able to serve them. Having healthy communities is our #1 priority. Everyone deserves the ability to control their reproductive future and access routine care from providers they know and trust. These Medicaid cuts are having broad impact on the entire healthcare ecosystem in our state. Clinics and rural hospitals are closing, along with labor and delivery units. This is straining the rest of the system and leading OBGYNs to flee the area. We are doing everything we can to shield patients from these cruel impacts, including continuing to provide Maine Care patients services without reimbursement. But this situation is untenable in the longer term. We need consistent annual state funding to prevent more clinic closures and layoffs. We urge the Maine State Legislature to protect this vital care that all Mainers deserve, regardless of how much money they make or where they live. Thank you.
Thank you for being here today. Questions? Yes, Representative Lemelin.
Thank you. Do you receive private funding?
We have a donor base, yes.
Okay. And how much did you receive in 2025 in private funding?
I am never the person that you want to give you numbers, but we could get that for you.
I would appreciate it. Thank you.
Seeing no other questions, appreciate you being here today.
Thanks.
Elaine Richards.
Hi, I'm Rachel Mankiewicz. I'm from Portland. I am reading on behalf of Elaine, who is from Fairfield. Senator Ingwersen, Representative Meyer, and esteemed members of the Committee on Health and Human Services, I'm writing today in support of LD 335, an act to safeguard reproductive rights. Maine's Family Planning Network, which consists of 19 Maine Family Planning Health Centers across rural Maine, 4 Planned Parenthood health centers in southern Maine, and 32 federally qualified health centers and 8 school-based health centers, provides comprehensive healthcare services in areas that are seeing more and more hospitals and healthcare providers leaving the area. If Maine's Family Planning Network is unable to remain open to provide healthcare in our communities, anti-abortion centers, AACs, will be in the position to fill that void. AACs are conservative Christian organizations whose primary goal is to keep people from accessing reproductive health care, including contraceptive care and abortion care. The 11 AACs in Maine are unregulated, unlicensed, and do not follow HIPAA. All people deserve to be able to access comprehensive primary medical care in their communities. Maine's Family Planning Network must be fully funded so that legitimate, regulated, licensed providers can provide safe and medically accurate comprehensive care. Thank you for your time and consideration. I urge you to vote ought to pass on LD 335.
Thank you for being here and reading that testimony. Questions? Yes, Representative Daigle.
You mentioned quite a few different centers and numbers pretty high. Do every one of these provide abortions?
This is not my testimony, so I am
She's
not
reading the
the
testimony for
person
someone
to
else,
ask.
probably.
Probably
But
get it
your question is noted, and I'm sure someone else can answer it or provide that info for the work session.
Thank you.
Thank you. Thank you.
Thank you.
Okay, Julia Colpitz.
Good morning. I am
Welcome.
not Julia Colpitz. My name's Victor Trepanier and I'm from Augusta, but I'm reading this on behalf of Julia, who is from Buxton. Senator Ingerson, Representative Meyer, and esteemed members of the Committee on Health and Human Services, I'm writing today in support of LD 335, an act to safeguard reproductive rights. Rural consumers rely on Maine family planning not only for their reproductive health, but also for larger healthcare concerns. In addition to the physical health services, family planning organizations are trained to identify possible domestic violence and sexual coercion, providing a first-line response in coordination with domestic and sexual violence resource centers. My work as a domestic violence advocate in Maine has demonstrated over and over again how important this is to protect survivors. They also provide first-line response to mental health issues, mitigating sexual health-related mental health concerns, along with the early DV intervention. Providing services for LGBTQ and trans Mainers is also crucial in this changing environment. These vital services will not be replaced by existing overextended clinics or private providers who do not have the expertise. We have a system of clinics that have demonstrated how well they work and that fill a crucial part of the larger health network, which is not duplicated elsewhere. Please support their ongoing functioning. Thank you for your time and consideration. I urge you to vote ought to pass on LD 335.
Thank you for being here and reading that testimony. We've got two more in the room, at least on the list, Anne Longley and Ellen Tarashi. Are Anne and Ellen here?
I'm going to read on behalf of Anne Longley.
Oh, yes, thank you.
And then for those waiting on Zoom, the last two testimonies, at least on my list, we'll complete and then we'll turn to you.
Good morning, Senator Ingerson, Representative Meyer, and esteemed members of the Committee on Health and Human Services. I am here today in support of LD 335, an act to safeguard reproductive rights. I didn't have health insurance until I was in my mid-30s. Planned Parenthood was instrumental in affordability of routine healthcare for me. I'll never forget the sensitivity and thoroughness of my care from the Planned Parenthood clinics. For birth control, they always gave me all my options and educated me on the pros and cons of each method. It would be a tremendous loss in our state if the family planning clinics were underfunded. Please vote to keep these vital clinics open. Thank you for your time and consideration. I urge you to vote ought to pass on LD 335. And I am reading this on behalf of Anne, who could not be here, so I'm happy to take questions, but cannot speak for her.
Thank you for being here. Seeing no questions.
Thank you.
Ellen. I think, okay.
Good morning, Senator Ingerson, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Ellen Tarashi, and I'm a nurse practitioner with Maine Family Planning. I'm here to support LD 335, an act to protect funding for family planning services. Since October 2024, I've been working on the front lines of the HIV outbreak in Penobscot County using our mobile medical unit. Our mission is simple and unwavering: to ensure everyone receives compassionate, dignified HIV testing and treatment. In a typical year, Penobscot County sees only 1 or 2 HIV cases. Since the start of the outbreak response about 2 years ago, Maine Family Planning has conducted over 400 HIV tests in Bangor alone. Despite these efforts, our HIV case count has risen rapidly to 38 confirmed patients. With our current resources, we're not reaching everyone who needs testing and treatment. Really, we should have seen this coming. We have the highest rates of hepatitis C in the nation, and where hepatitis C shows up, HIV is soon to follow. People who are at risk for hepatitis C and HIV are also typically at risk for other sexually transmitted infections such as gonorrhea, chlamydia, syphilis, as co-infections are common. In fact, there's been a 500% increase in syphilis cases from 2014 to 2023. For the first time in decades, babies are being born with congenital syphilis, signaling widespread undiagnosed infection among adults. Prior to 2022, there were 0 reported cases of syphilis for at least about 20 years. In 2023 alone, there were 104 cases. That is unacceptably high. The reach of this sexual health crisis is ever widening. It truly goes to show that when we ignore Mainers' needs for preventative care and reduce capacity for proactive care, we end up having to react to an avoidable crisis. Chronic underfunding and active disinvestment in sexual and reproductive health has created a fire that we are trying to put out without access to a fire hose. A robust, adequately funded sexual and reproductive healthcare network in Maine going forward would act as a systemic sprinkler system to put out embers before they turn into blazes. Increased state funding would allow us to add staff and double our testing and treatment capacity. Currently, we are stretching limited, short-term, unstable grant funding to respond to a growing public health emergency. Now is not the time to shortchange sexual and reproductive health funding. We need sustained investment to continue responding to this emergency and to prevent the next one. With federal family planning funding under threat, Maine's state leaders must step up. A healthy constituency is the foundation of a healthy state. HIV prevention and treatment, STI testing, vaccinations, cancer screenings, basic primary care, these are not luxuries. They are basic public health necessities. We urge our legislators to fill this growing financial void and invest in the long-term health of Mainers. These funds are urgently needed to stabilize our clinics, sustain our workforce, and ensure anyone who needs care can receive it now and in the future. Thank you for your time and consideration.
And thank you for being here today. Questions from the committee? I'm seeing none.
Thank you.
I believe, you have one more. Okay, come on up. Of course, we'll hear everyone. We've got, I don't know, 5 or so people on Zoom, and I just want to let them know we haven't abandoned them. We're just trying to get everybody in the room heard. So please.
Hi, Senator Ingerson, Representative Meyer, and esteemed members of the committee. Thanks for hearing this testimony. My name is Matthew Cease. I'm an employee at Maine Family Planning, and I'm reading testimony submitted by Mary Eddy. I'm writing today in support of LD 335, an act to safeguard reproductive rights. Maine Family Planning was my primary health care all through my late teens and 20s. They provided me with STI testing and remedies, as well as a variety of birth control options. I'm a merchant mariner and I shipped out, so I needed larger quantities than most doctors would prescribe. But the staff at Maine Family Planning understood and supported me in my career. That career took a shift once I got pregnant after my marriage. I'm now a harbor master as well as a mother. I would not have been able to build myself the stable, productive, and rewarding life I now lead were it not for Maine Family Planning. Thank you for your time and consideration. I urge you to vote ought to pass on LD 335.
Thank you for being here and for reading that testimony.
Hi again. I'm hoping to read testimony on behalf of Alicia Ray with the ACLU, who's stuck in a different committee.
Okay.
Okay. So this is on behalf of Alicia Ray and the ACLU of Maine. Senator Ingerson, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Alicia Ray. I'm a policy fellow with the American Civil Liberties Union of Maine, a statewide organization committed to advancing and preserving civil liberties guaranteed by the Maine and U.S. constitutions. On behalf of our members, I urge you to support LD 335. Maine has continually affirmed its support of the freedom to access not only reproductive health care, but also primary and behavioral health care services. However, these protections mean little if they exist only as rights on paper, and Mainers lack meaningful access to care. LD 335 ensures that protections the Maine legislature has enacted and expanded for family planning services are available for all Maine people, regardless of their ability to pay. A person's individual resources should never restrict their reproductive freedoms. Federal efforts to prohibit funding for healthcare that is legally protected in the state have led to the discontinuation of primary care services in Maine. These reductions in services disproportionately impact low-income Mainers and rural communities such as Holton, Ellsworth, and Presque Isle. This is also harming community members who do not rely on primary care at these now closed clinics. Their closures have placed additional strain on other local healthcare facilities, which were already overburdened. While these cuts directly targeted our neighbors with fewer resources, the consequences are harming all Mainers. When healthcare funding and reimbursements are limited, the result is a functional ban on care. Targeted defunding that forces clinics to reduce services effectively accomplishes what cannot be undone under Maine law, eliminating access in practice and creating a right in name only. Without sustained state funding, Maine's strong protections for reproductive freedom are undermined by politically targeted and onerous federal restrictions. LD 335 affirms that in Maine, access to healthcare does not depend on a patient's income or federal politics. By offsetting federal funding gaps and creating an emergency funding mechanism in the event of further Medicaid or Title X cuts, this bill safeguards both access to care and the ability of patients to make the best choices for themselves. Nearly 30,000 Mainers rely on the family planning healthcare network each year. And for most, these clinics are the first or perhaps the only provider they might see. Protecting these rights and creating a freedom that Mainers can truly exercise requires more than words on paper. It also requires the infrastructure and funding to create and support community healthcare. LD 335 is the legislature's opportunity to ensure that all Maine people can exercise their rights in reality. We, the ACLU of Maine, urge you to vote that LD 335 ought to pass. Thank you.
Thank you for reading that testimony. Seeing no questions. We're going to move to testimony in support on Zoom. So we'll just take it as you bring the folks over. Thank you. Gotta turn this over to you. I'm going to turn this over to you. You're right, Matt. That's,
Yeah.
yeah.
Augustin Villarreal.
Yep, I'm right here. I'm ready.
Okay. Great. We're just remind people on Zoom, we run a 3-minute clock.
All right. Hello, Senator. My name is Augustine Villarreal. I live in Sugar Land, Texas, and I'm here today to testify in support of LD 335 and support the essential funding for family planning services in our budgets as we look at the challenges facing Maine families in 2026. The $2.25 million in the sentimental budget is not an optional expense. It is a critical replacement for lost federal funds. And many of our rural communities, these clinics are the primaries and often only source of cancer screenings, STI testing, and wellness care. Furthermore, I urge you to pass LD 335. This bill ensures that deeply personal medical decisions remain between a patient and their doctor. And without political interference, it protects our healthcare workers and ensures that Maine do not have to leave their states or their support system to receive the care they need. These measures are a reflect on Maine values, privacy, community health, and individual liberty. Thank you for your time and your service to the people of Maine. Thank you.
Thank you, Augustin. I'm going to go. Do you have 2 more pieces of testimony to read? Are they from you?
They're for me. They're from me. It's only this is the only one I have.
Oh, okay. I saw you there 3 times. I'm just curious. Thank you so much for your testimony on Zoom.
Yeah. Thank you.
Esther Pugh.
He signed up 3 times.
Hello. I don't know if you want me to turn my video on or not, but it won't let me. Okay, awesome. There we go. Hi, everybody. Senator Ingwersen, Representative Meyer, honorable members of the Health and Human Services Committee. My name is Esther Pugh. I'm a senior organizer at the Maine People's Alliance. Our 32,000 members are committed to creating a world where everyone has what they need, contributes what they can, and no one is left behind. Thank you for the opportunity today to speak to you in support of LD 335. As an organizer, I spend my day talking with MPA members and others in the community. When I ask them what issues are most important to them, healthcare access continues to rise to the top. This especially includes reproductive health care. With the tax on reproductive care continuing at the federal level, slashing budgets for necessary organizations and services. It is the responsibility of our state to step up and make sure all Mainers are able to access the care they need. So I'll tell you, being pregnant is scary. I'm days away from my third trimester. I'll be in the third trimester on Friday. And this is a planned pregnancy, but it doesn't mean I haven't spent much of it scared or worried about test results or other complications when it comes to my care or the care needed for my future child. An invoice just came in from one of my tests that was over $500, and that's with my employer provided insurance kicking in. Everyone, regardless of ability to pay, needs access to high quality prenatal and family planning healthcare. Those who provide abortion services must have full funding because it makes it easier for everyone to get their healthcare needs met. We can have strong laws protecting reproductive rights, but we need to make sure that everyone is able to access the care they need. I'm one of the many over the years who has gotten necessary care from a Maine reproductive healthcare provider. I benefited from getting medically necessary pap smears, STI testing, vaccines, and more. Without Planned Parenthood and other providers like them, I would have been out hundreds, if not thousands of dollars getting this necessary preventative care. Knowing that these agencies have been cut so deep by a federal government that is essentially targeting them because they provide abortion care is deeply frustrating and angering. Through LD 335, we have the opportunity to ensure that patients from across the state can continue to access essential health care at Maine's reproductive health care providers despite the federal attacks that continue. We must protect access to care for the most vulnerable people in Maine now and into the future. By offsetting the funding hole created by the federal government, creating an emergency state funding mechanism to provide funding for patient care, and earmarking ongoing funding to reproductive healthcare providers, Maine can continue to lead the nation. Thank you.
Thank you so much for your testimony. Any questions for Esther? Seeing none. Francesca Basile.
Hi.
Hi, welcome.
Hi, thank you for having me. Senator Ingwerson, Representative Meyer, and members of the Committee on Health and Human Services. My name is Francesca Basile. I am a constituent in Kittery, and I urge you to vote ought to pass on LD 335. For the past several years, I've dealt with reproductive health issues that are at times debilitating. Blood loss that has caused me to pass out at work, weakness that prevents me from leaving the house, pain that has forced me to pull over on I-95 so sudden and overwhelming that I'm unable to drive. Over the years, I've dealt with these problems with the support of the excellent gynecology team at York Hospital. I'm privileged to have health insurance that covers the hormonal birth control that keeps me functional and surgical procedures that have given me temporary relief, not to mention the countless exams and ultrasounds required to monitor my condition. I have supportive family and friends and a job with understanding management that allows me to work remotely when needed. But I know that not everyone has these advantages. For those without health insurance or financial resources, reproductive health centers that receive funding from the state are critical. If I couldn't get reproductive health care, I would not nearly be the productive member of society that I am today. I'd work less, I wouldn't be out spending money at local businesses, I wouldn't be an active part of my community. This is the situation that is faced by those who can't get the help they need. When someone is so debilitated from a reproductive health issue that they can't leave their house, then they're not helping this state reach its potential. It's in Maine's best interest to keep its residents healthy. And when attacks on reproductive health care at the federal level are creating a new level of urgency, we can't afford to wait on this additional funding when waiting comes at the expense of Mainers' health. By providing state-level funding for the Family Planning Care Network, LD 335 would help maintain access to family planning care services, from birth control to cancer screenings to diagnoses of infections and wellness checks. Overall, it helps the most vulnerable Mainers access healthcare when they need it. Please vote ought to pass on LD 335. Thank you.
Thank you so much for your testimony. Are there any questions? Seeing none. James Mayall.
Good morning, everyone.
You're all set, James.
Okay. Good morning, Senator Ingerson, Representative Meyer, members of the Joint Standing Committee. My name is James Mile. I'm a policy analyst at the Maine Center for Economic Policy. I'm here to testify in support of LD 335. MECEP knows that family planning services and other healthcare services offered by family planning providers are an important piece of Maine's healthcare landscape, especially for Mainers with low incomes. Like many organizations, family planning providers in Maine face intense uncertainty about the availability of federal funding. President Trump has already attempted to withhold Title X funding from family planning services and has proposed eliminating the program entirely. Last year's federal reconciliation bill took away millions of dollars that would be used to provide a wide array of additional services at family planning clinics across the state. These cuts and threatened future cuts put dozens of clinics serving 30,000 Mainers across the state at risk. LD 335 would offset that risk by having the state step in to fund these critical services when Washington leaves Mainers behind. The family planning providers who would be supported by LD 335 form a safety net for many Mainers with low income. Half the patients at Maine Family Planning and a quarter of those at Planned Parenthood's Maine clinics are enrolled in MaineCare. More than 1/5 at Maine Family Planning have no insurance at all. In the wake of the federal reconciliation bill, Maine's Department of Health and Human Services predicts that 31,000 MaineCare enrollees will become uninsured, making the presence of clinics like these even more important in the future. In addition to helping individuals access healthcare, the funding in LD 335 will be an important investment in a stronger Maine economy. Research shows that access to family planning services and the ability to make informed choices about their reproductive future leads to better economic outcomes for women, including better college graduation rates, more participation in the workforce, higher wages, and less likelihood of living in poverty. Reproductive freedom also means better outcomes during pregnancy and birth, resulting in fewer cases of preterm and low-weight births, which can have lifelong health and developmental impacts for children. In promoting public health, family planning services save taxpayers money over the long term. One study found that for every dollar spent on such services, taxpayers save $7 in avoidable costs for treating future conditions like sexually transmitted infections, cancer, and preterm births. On top of this, Mainers with private insurance plans save indirectly. Investing in preventative care services reduces insurance premiums because it means fewer visits by Mainers to the emergency room and fewer diagnoses of acute conditions which could have been spotted and fixed much earlier at a lower cost. Funding LD 335 will protect Mainers' health, improve economic conditions of thousands of people across the state, and ultimately save taxpayers money. I would urge you to vote for to pass, and I'm happy to take any questions.
Thank you for your testimony, James. Do we have any questions? Seeing none.
Thank you.
Kate, Andy? And then last up on Zoom, I have Peggy York after Kate. Okay. Hi, Kate.
Hello, good afternoon, Senator Ingerson, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. I'm Kate Endy, Policy Director for Consumers for Affordable Health Care. Thank you for this opportunity to provide testimony in support of LD 335. Consumers for Affordable Health Care, or CAKE, as we call it, is a nonpartisan, nonprofit organization that advocates the right to quality, affordable health care for every person in Maine. We operate a toll-free helpline that fields thousands of calls and emails every year from people across the state who need help obtaining, keeping, using, or fixing problems with private health insurance or with accessing or affording healthcare services, including primary care and sexual and reproductive healthcare services. CAKE also serves as the ombudsman program for Maine's Medicaid program, MaineCare, and helps people apply for and navigate the enrollment process for MaineCare. So it's with that background that we provide this support. Maine's family planning providers are often the only source of care for their patients, delivering essential services such as STI testing, cancer screening, gynecological exams, behavioral health care services, and even primary care. Without adequate funding, many Mainers will lose access to these critical services, putting the health and well-being of thousands at risk. The urgency of LD 335 cannot be overstated, as family planning providers are facing increasing financial strain. Provisions in HR 1 bar Maine Family Planning and Maine's Planned Parenthood health centers from receiving federal reimbursement for services they provide to Maine Care patients. These providers have been without Maine Care reimbursement since that law was signed last July. Yet they have remained open and continue to provide care to patients regardless of their ability to pay or be reimbursed. Meanwhile, federal policies threaten to further destabilize access to reproductive health care, including threats to Title X, the Federal Family Planning Funding Program. Furthermore, on the state level, these providers have been flat funded for over a decade. Through our helpline, we hear from people who have trouble finding healthcare providers close by in different areas of the state. Uninsured and underinsured Mainers face additional barriers when trying to access care. And we know that thousands of Mainers trust and rely on family planning providers to access and afford the medical services that they need in their communities. By passing this bill, the legislature will ensure that Mainers throughout the state, regardless of their income or insurance, will continue to have access to the care that they need. Thank you for your time and encourage you to support LD 335, which will bring relief and better health to Maine families and communities. Thank you so much.
Thank you for your testimony this morning. Any questions? I see none.
Thank you.
Peggy York?
Kate was the last one.
Oh, okay. No, Peggy York. All right. Any further testimony in the room in support of this bill?
Alex, did you want to testify? Yeah. Alex.
Yeah, you
Okay.
asked her. Oh, no, I already went.
You already went?
Oh, I'm
Yeah.
sorry. Sorry.
Yeah. Testimony in opposition to this bill. I have Ann Ross from Hamden.
Senator Ingerson, Representative Meyer, and members of the Committee on Health and Human Services. My name is Ann Ross. I am here to voice my opposition to LD 335. Let's examine the underlying cause or underlying reasons for giving $5 million in taxpayer funding to Planned Parenthood and Maine Family Planning. Why do they need this money? Well, this money is needed to fund their business that attempts and succeeds to help women and the lives of babies. Does anybody think this is wrong? Science says the preborn baby is a human being. And I quote, DNA is present in the human body from the moment of fertilization, when the egg and sperm combine to form a full genome, throughout a person's entire life, residing in the nucleus and mitochondria of almost every cell. The body continuously maintains, uses, and replicates this genetic code with its roughly 30 to 37 million trillion cells. Now that means that the preborn baby, from the moment of conception, is a person, a human being, not a random bunch of undefined cells. So it is wrong to prevent the preborn baby from being born. Thou shalt not kill. We all recognize one of the most recognizable 10 Commandments. Whether you're a believer in God or not, taking the life of another human being is not an acceptable act. Our society knows it is wrong to take the life of another human being. It's called murder. Therefore, supporting a person, persons, or in this case, the behemoth organization of Planned Parenthood, who gives their managers directives on how to promote abortions, which we all know is the killing of an unborn baby, known because they have complete DNA at conception, and we know this is wrong. Therefore, supporting the Maine Family Planning, who distributes abortion pills to women without doctor's appointments, with the express purpose of extinguishing the life of the preborn child, is wrong. Therefore, it is reprehensible that we would support these organizations, never mind giving them $5 million a year, never mind requiring Maine taxpayers to fund it. This is wrong. If Maine has some extra money hanging around, How about we start with life-giving care? Across Maine, we know maternity wards and birthing centers have closed because hospitals say they lack sufficient funding. How about we support women who want to have their babies instead of those who want to get rid of their child or children? And how about we pay for counseling these women who don't want to have their child? Why would we do that? Because the majority of women who want an abortion says they have no choice, no one to support them. Let's support life-giving alternatives. Let's start making the right choices, providing and affirming life-giving options, not life-ending options. LD 335 is taking us all down a path of destruction of human life. It's not good human sense or moral sense, and it's not good business sense. Thank you.
Thank you for your testimony this morning. Do we have any questions for Ms. Ross? Seeing none. Ruth Rogers from Bangor.
Senator Ingerson, Representative Meyer, and members of the Committee on Health and Human Services. My name is Ruth Rogers and I live in Bangor. I'm here to give testimony in opposition to LD 335, an act to safeguard reproductive rights. If federal dollars stop flowing to Planned Parenthood and Maine Family Planning because of their abortion practices, Maine taxpayers should not be forced to bail them out. If we are talking about bailouts, let's start with life-giving care. Across Maine, maternity wards and birthing centers have closed because hospitals say they lack sufficient funding. For the baby coming into the world, it is becoming harder to find care in many parts of Maine. Over the last decade, 11 birthing units in Maine have closed, 4 of which closed in 2024, forcing people to travel greater distances to give birth. Aroostook lost half of its maternity wards. Waldo County saw its only birthing unit close, and there are now no hospital labor and delivery services in northern Penobscot. If Maine truly has money to spare, it should go toward reopening and strengthening those services, the ones that protect mothers and babies. As you know, in the last legislative session, Maine lawmakers already authorized millions in direct state funding for abortion providers. Abortion groups asked for tax dollars, and they received them. I urge you to stop using taxpayer money to underwrite an industry that measures success by the number of abortions performed, prematurely ending human lives here in Maine. Honorable committee members, I urge you to use your leadership position to vote ought not to pass LD 335. I urge you to be fiscally responsible on behalf of all citizens of Maine. Thank you.
Thank you for your testimony this morning, Ms. Rogers.
Welcome.
Do we have any questions? Seeing none. Holly Lusk, I believe it is.
Good morning or afternoon, I don't know.
Almost.
Senator Ingerson and Representative Meyer and members of the HHS committee. You have testimony in front of you. I am actually not Nick Adelson. He is much taller than I. However, he is the executive director of the Christian Civic League of Maine, and I am a contract lobbyist. I'm a solo practitioner, a lawyer who works on behalf of the Christian Civic League, and I'm happy to be here today. Thank you for the opportunity today to testify in opposition to LD 335, an act to protect funding for family planning services. And I note that the title had changed in the amendment, which is why I've used that title. This bill appears to create 3 distinct funding mechanisms, and I note that Representative Kuhn in her testimony actually may have indicated kind of 4, so 3 or 4 distinct funding mechanisms for the abortion and family planning industry in Maine. First, by appropriating state funds to match any lost Title X funds. Second, appropriating state funds to match any lost Medicaid funds for entities whose business is abortion, and by appropriating $5 million extra for unrestricted grant funds to entities in the family planning and abortion industry. Maine taxpayers are already footing the bill for extensive abortion and family planning services through MaineCare. Unlike federal policy, which places limits on taxpayer-funded abortion, Maine requires taxpayers to fund these services even for full-term abortions. Advocates for the bill may insist that the funding is for non-abortion services because Title X funds cannot be used for abortions. This claim would ignore 2 key realities. First, money is fungible. Just as a gift to cover someone's groceries frees up cash for other expenses, taxpayer dollars that cover general operations inevitably support the broader mission, a mission that has resulted in nearly 70 million abortions nationwide in the last 50 years. Second, and more important, this bill would not impose the same requirements on how the money is spent as Title X does. There are no clear limitations or restrictions on the expenditure of the grant funds. Maine Family Planning, as the state's Title X grantee, provides, according to its own website, in-person abortions, abortion pills through the mail, birth control, hormonal gender transition therapy for teenagers and adults, teenagers 16 and up, sex education for school children, and more. Maine Family Planning also provides funding to subgrantees such as Planned Parenthood and school-based clinics. Unless the legislature imposes clear requirements for how funds can and cannot be spent, recipients will be able to spend them how they choose, including in ways unsupported by the vast majority of Mainers. The bill's title asserts that this $5 million in annual funding, meaning the $5 million in unrestricted grant funds, will protect funding for family planning services, ostensibly because the state's Title X family planning funding may be cut by the federal government. But this total amount of Title X funding flowing to Maine is less than $2 million annually, and it was $1.925 million in 2024. So the appropriation doesn't protect Title X grantees. It would provide them with a substantial increase, 100% for any lost Title X and Medicaid funding, but in state dollars, plus an additional $5 million to be used for whatever purpose Maine Family Planning or its subgrantees desire. I strongly urge you to reject this bill. Maine's families deserve better. Thank you for your time and consideration.
Thank you for your testimony this morning. Any questions? Seeing none.
Thank you.
Any further testimony in opposition to this bill? In the room, we have none on Zoom. Any testimony neither for nor against this bill? Seeing none. Any requests from the committee for more information for the work session? Yes, Representative Graham.
Thank you, Mr. Chair. I wanted to find out the impact of loss of Title X funding or restricted Title X funding to FQHCs. I didn't realize that that funding actually went over to FQHCs. So if we can try to find an answer to that from the Maine Primary Care Association, that would be great.
Any further requests? Seeing none, that brings to a close our hearing this morning on LD 335. We'll be back at 1 o'clock for 2 work sessions. We'll probably do a short caucus, I would say.
Yeah.
12:45.
Yep.
Something like that. 12:45 caucus, D's.
See you. Yeah, this is fine. This is the one I speak of. So ask me to do what I gotta do. Every time.
I'm sorry.
I got
We're back. No need for introductions. We're all here, no new additions. Oh, go ahead.
In the room here.
Thank you, Mr. Chair. Good afternoon, everyone. My name is Ann Fredericks. I represent House District 143 in Sanford.
Thank you. Thanks for being here this afternoon. This afternoon, we have two work sessions. We're going to go in this order, LD 2051 and LD 2065. And we'll start off with 2051, an act to ensure the Supplemental Nutrition Assistance Program in Maine.
Good afternoon. This is LD 2051, an act to ensure access to the Supplemental Nutrition Assistance Program in Maine. This bill was presented by Representative Pluker. This bill provides that in the laws governing SNAP, the term non-citizen lawfully legally admitted to the United States includes without limitation any person who is pursuing any lawful immigration status who has permanent residence in the U.S. under color of law, or who is eligible to receive SNAP as of July 3rd, 2025, but is no longer eligible for federally funded food assistance benefits pursuant to the One Big Beautiful Bill Act. You heard testimony in favor of this bill, noting that the One Big Beautiful Bill Act cut SNAP benefits for certain groups of legal applicants, including refugees, asylees, certain survivors of trafficking and abuse, and other previously qualified humanitarian immigrants who are no longer eligible for federal SNAP. This bill would add those folks to the list of people who are eligible for state SNAP. State SNAP acts as a bridge to stability for immigrants. So the bill clarifies the definition of non-citizen legally admitted to the U.S. to ensure, again, that those who lost benefits last summer can receive state benefits. I think it's difficult. Folks testified it was difficult to estimate exactly how many folks this would impact. One commenter thought it would be about 2,000, but I think that number is uncertain. Let's see. So it was noted that individuals who have lawfully applied for asylum status are work restricted from the time of application for 150 days, and processing time can bring them to 180 days, during which time they're dependent on safety nets like SNAP. Folks also noted the high rates of food insecurity in Maine compared to the rest of New England. Opponents of the department had testified in opposition due to the cost of the proposal at a time when federal policy changes are imposing significant financial burdens on Maine. OFI noted they are in the process of rulemaking to make these changes in regulation. There was also testimony that the state should not be responsible for backfilling the loss of benefits due to federal changes. And that the terms pursuing lawful immigration process and those with permanent residence under color of law, as is reflected in the original bill, that those terms are too broad and difficult to tell what groups of people they're including. So as background, again, the Maine state SNAP benefit provides SNAP equivalent benefits for legally admitted non-citizen individuals who would be eligible for federal SNAP, but for their immigration status. The Personal Responsibility and Work Opportunity Reconciliation Act of '96 limited SNAP eligibility for certain non-citizens. It allowed states to provide state-funded SNAP benefits for ineligible non-citizens under state law. In 1997, Maine established our state SNAP benefit. Currently, there are a number of groups of folks who are eligible for state SNAP. There is a grandfather group of individuals who were eligible for state SNAP on July 1, 2011, but a change to federal law made them ineligible. The state law grandfathers that group in. And then certain elderly or disabled individuals, certain victims of domestic violence, people who are experiencing certain other hardships, and people who are unemployed but have obtained proper work documentation. And again, all these folks need to be legally admitted. These categories are further described in rule, which is much, much longer than the statute, and goes into great detail. You have actually the proposed rule in your packet. And you can see where those changes are reflected. So the OFI did propose that rulemaking, and it is currently undergoing the rulemaking process. So in the bill itself, again, that term, some of the terms are a little, I think, difficult to interpret. So pursuing a lawful immigration status it probably would need to be fleshed out a little more. You do have a proposed amendment in front of you from Representative Pluker, and you have a further amendment based on that proposed amendment that the department has been working on. So I think I'll just go to that one because I think that's where folks are at. So that is this document. So what this does is instead of defining folks who are lawfully present, it lays it out in a way I think is a little easier to understand because you have that grandfathered group. The way that the statute was structured before was really clunky. It was like this grandfather group, but then also this group, and then we're going to create another definition, and it was not easy to follow. And I think this is actually quite a bit easier to follow. So this would pull into the group of folks who are not grandfathered in, but who have a qualifying immigration status. It would list those out. So people who are qualified aliens under 8 USC 1641, that is a whole group of people that's listed in federal law. Folks like conditional entrants, those folks are included in that group. Also lawful permanent residents under the Immigration and Nationality Act, asylees, individuals with a pending application for asylum or withholding of removal, refugees, individuals with temporary protected status, and individuals with special immigrant juvenile status. That is the one group that I understand that is not currently covered, but is being pulled in here. And I would note also the definitions for 1 and 2 qualified aliens and lawful permanent residents, for lawful permanent residents, and there was another group of individuals who have experienced, who have been battered. So I think there was a proposal to use the language that appears in Pluker's amendment, the first 2. So if you look at the first document in your packet, you have the original version of Pluker's amendment. So if you look under 5A 1 and 2, I think the idea is to use those definitions for LPRs and then pull in that battered individuals because that language is a little more precise in that draft. And then additionally, we would pull in what appears as B under Pluker's amendment, that is individuals who received or eligible to receive federal SNAP on July 3rd, 2025, but who are no longer eligible because of the Big Beautiful Bill Act. So they would be added as it would be actually 9, but it looks like an 8 on your list here of individuals with qualifying status. And this does retain the requirement that you have to have one of those statuses, right? But you also have to have a qualifying condition. So that is B here, that is BAB. That language is retained. And there's a little change made to, I think, domestic violence or human trafficking, and then further pulling out what experiencing other hardship means. So instead of that being unable to work or the dependent child of a parent unable to work due to. So I think this amendment I think it pulls in everybody who Pluker's amendment pulled in, but it does it in a slightly different way that's a little easier to follow. And I think I covered everything there.
Yeah.
Go ahead. Just discussion, comments? Rep. Saker.
Thank you, Madam Chair. Food is fundamental to health. I think that's very much in the purview of this committee, certainly in line with my values. The testimony from the American Academy of Pediatrics main chapter describes the mechanisms of that. So I'm supportive of these, and I appreciate this amendments. Appreciate the work that Sam put in to clarifying it for us.
I would just follow up on that. Gratitude to Sam, to Representative Pluker, to Alex Carter from Maine Equal Justice and the department for working together to bring us what we've got in front of us. And Sam will further work the two amendments into one and bring that back to us. Okay. Representative Daigle.
Is there any fiscal note attached to this yet?
We don't have one yet. It's, so I would, because the department's already doing this in rulemaking, I wouldn't anticipate a large fiscal note because those costs would have been considered in that rulemaking. So I don't anticipate a big fiscal, but we don't have it yet.
Okay, any further questions? Discussion? If not, I'd entertain a motion. Go ahead.
Thank you, Madam Chair. Ought to pass as amended.
I'll second it.
To move.
There's a motion and a second, ought to pass as amended. Any further discussion? All in favor? Those opposed? And the minority report. Okay. Thank you.
Next up, 2065.
This is the work session for LD 2065, an act to provide one-time funds to support the construction of a psychiatric residential treatment facility for at-risk youth. This is Senator Ingerson's bill. So this bill provides one-time funds to support the construction of a PRTF, which would serve at-risk youth under 21 years of age. The department testified in favor, noting that quite a bit of work has been put into the development of a PRTF facility thus far. Proponents noted that Maine requires inpatient psychiatric beds for children, and a number of folks referenced the problem of kids waiting in the ER for appropriate placements. Many of these children, it was folks testified, end up in out-of-state placements, places like Georgia and Arkansas. Over 70 Maine kids are placed out of state currently, with over 100 waiting. Maine Health testified about the 284 kids that have spent time in over 48 hours in their ED last year. Northern Lights similarly had 153 kids waiting in their ER. There was an opponent who noted that this is an institution-like setting, and we should be pursuing community services and not institutional services. So for background, quite a while ago, in October of 2018, MaineCare finalized the rules for PRTFs as a new MaineCare service, and it was approved by CMS. But as of yet, no provider has offered that service due to the cost of constructing this facility and the overall cost of providing that care. In 2024, as part of the supplemental, the legislature did appropriate $2 million to support the creation of a PRTF, and it required DHHS to issue an RFP. DHHS did so, and Sweetser won that award in December 2024. Sweetser reports that the PRTF will serve individuals with severe psychiatric illness and include services for co-occurring disorders, kids with problem-sexualized behaviors, and kids with secondary developmental disabilities. It'll be a 16-bed, 8,000 square foot facility providing 24/7 care. And it's anticipated that kids will stay for about 6 to 9 months before being stabilized and being transferred to other settings or back home. It will be accredited by the Council on Accreditation and comply with CMS conditions of participation. There's quite a lot of CMS rules around PRTFs. Sweetser stated that $2.5 million in funds will be raised by Sweetser, but the market conditions for construction have resulted in this costing more over time. This bill would cover $1.1 million of the $3.4 million that is anticipated that will be needed. Of note, the governor's supplemental budget, which we went over yesterday, includes an appropriation of $3,399,600, there should be a comma there, $680 to support APRTF. There were some questions about the cost comparison of sending a child out of state for treatment versus a PRTF, and then whether there is workforce to support the PRTF. And I think Abby is here and could speak to those questions. So there's the preliminary fiscal, which presumably wouldn't change, is 1.1 million. And I've included the fiscal and also a document from CMS that describes what a PRTF is, just a little 2-pager, the first white document you've got. And then I've included the language from the supplemental part and that directed funding for the PRTF. And then you've got the rules here, which you'll see have not been amended since 2018, but I believe will be. And so that's that. Oh, I'm very sorry. You also have the answers to questions that were posed to Sweetser, both here and during the public hearing. You have copies of that in front of you and also emailed to you yesterday.
So the funds in the budget, proposed in the supplemental budget, cover the total amount needed by Sweetser to complete.
That is my
The
understanding.
funding. And if I recall the public testimony here, there was some fundraising going on. This bill was anticipated, hopefully not needed, and we found ourselves in the ideal position here of all those funds now being in a supplemental budget. So I would propose that this bill is no longer necessary. Yeah, unless there's additional discussion around that. I mean, I think it's very clear that this committee has worked for a long time and has fully supported the creation of a PRTF in this state. And this committee in total is very pleased to see those funds in the supplemental budget, and that this committee will work that supplemental budget tomorrow. And my guess is very strongly that we will be unanimous in supporting that line of the budget. So with all of that said, I would move ought not to pass on LD 2065.
Second.
There's a motion and a second. All in favor?
Anna is going to come do some language review.
Okay. So is she here? No. So we'll take a few minute break and wait for Anna Broom.
She's on her way.
All right, the first one coming around is an almost final. This is LD 2125. This is the bill with the $1 million for the emergency funding for the children's residential care services. If you remember, there was just a couple of changes to this. One was to the whereases, and the other was the non-lapsing funding. Eventually, you will see this fiscal note included in the amendment, but it is on its way back to revisers to do that. But this one is essentially finished. The next one coming around is the only one that is actually not a final. So you'll see it again one more time. This is the concept draft that actually ended up being the language from the 988 report, if you can remember, the one that Bree came from the department and gave you. But this is language that you had already been considering for Senator Nangle's bill. So this is the one that defines 988 and the 988 Suicide and Crisis Lifeline. And this, the change in section 3, the language in section 3 is very similar to what you saw at the amendment, at the work session, I guess, actually. But we had mentioned that this was very old language that they were amending in the statute from 1987. And so I worked with the department. And so basically it's just replacing the language that was in 3621. It's almost exactly the same. It's the lead-in basically that is different, which is the department establishing crisis intervention support services in all 16 counties. Because originally, if you remember, it was just 3 counties were in the statute. That's how old the statute was. And so this is that language just sort of updated. So you'll see this one more time when it is finished. Sorry, I should have been giving you the next one. Sophie. Thank you. So if that one is okay with you, and I did give a copy to Senator Nangle this morning as well. I feel like I'm about to mess up my files. Okay, do you have 2083? Is that what is in front of you? Yes. 2083, yeah. This is the CRMA bill. This is just a technical change. The fiscal note is exactly the same as the original bill, which is attached, is the same as the fiscal note that you had at the work session. So this is OSR money, so it's not general fund. So this was just a technical change to clarify. The original sentence in the bill had said that the fees must be set by rule and be valid for a 2-year certification period. That wasn't really what they meant to say, which was the fees should be set by rule and the certification period is for 2 years. So that is a technical change. I did go around a little bit with the original language around unlicensed assistive personnel. And I decided, and then I talked to Sam, decided that the language in the original bill was actually correct. We just needed the clarification from Bill Monteo that they were talking about the same population of people. But when it came down to it, the only drafting change that needed to be was that clarification of that sentence. So that one is ready to go out the door. Okay. The next one. Here's the next one, Sophie, I'm sorry. This one, and then there's one more. Thanks. Okay, so this is LD 1414. This is another final. This is a majority report. This is the only divided report that you're looking at today. This is Senate President Daughtry's bill, and this is the one that has funding funding for, I can do this, I can talk. This is, oh, right. This is the one that increases the rates for infant toddlers under the CCAP. There is already an increase. It's 10%. This would raise it to 20%. And then the second part was the grant program. And this fiscal note is the position to oversee the grant program in addition to the final language. So you had not seen this. And then there is the funding for the increased rates as well, and that's in the fiscal note. So the appropriation and allocation section has both of those things in it, the position for the grant and then the additional for going from 10 to 20%. Okay, 2134, is that the next one that you have? So you have seen this one. This is just the final and the fiscal note. So you had seen the language. This is the pharmacies and the grocery stores that are in the same location but are not, but are differently, two different businesses. And this is just the fiscal note with some minor reduction of workload associated with the number of cases that will no longer be filed, and which is really standard language for correction and judicial impact statements, and then the revenue increase that is related to the licenses of those 7 pharmacies. So that one is also ready to go out the door. And then the last one is 1728. This is
Go back.
Yep.
The fiscal note is related to the licensing?
Yes, because I believe that there are 7 licenses that wouldn't be renewed. And now they can be.
Okay.
It's a very small one, and it is a revenue increase, so it's savings.
Okay, gotcha. Yep.
And the last one, this is Senator Inglison's bill. This is 1728. I can't remember. I know you've reviewed this, but I can't remember how far along it was. So this is a unanimous report. This is all related to the changes in the rules at the federal level. So this is basically enshrining a lot of what the department is doing now, which is why you can see on the back that there's a no fiscal note needed. So this is the one that relates to the co-payments being no more than 7%. That's the case. That's what it is now. So that's why there's no fiscal note associated with that. The language about posting the co-payments on the website is in there, and then Section 3 is essentially the same language from a bill that you looked at last year, which actually went to the table, no longer needs to be on the table, but that's beside the point. And that's the one around enrollment rather than attendance. And then the last part was the subsidy being above the equivalent private rate, and that was for to ensure that those providers that are taking subsidy receive the same as what the other providers that are receiving subsidy get if they are charging less than the market rate in their area. So that is also a unanimous report. And that is another one that is ready to go out the door.
Great. That's great.
Yes, I have, but we all have. So that's it. That's all I've got.
Okay.
Great.
Thank you.
Thank you.
Wow. I don't know much.
And it's only 2:00.
It's only 2:00.
Could have had another public hearing.
Not like this morning, please.
Okay, so
So tomorrow will be starting at 2 to begin voting on the supplemental budget.
yeah,
Correct?
give us some time to caucus if
Yeah,
you
we
feel you need
caucus.
this. Yep. Okay, so
So that's it. Well, we haven't got it yet.
That we have that.
Oh, that's where we have it.
Just a reminder, there's required harassment training for,
And the House
if people haven't done it in December, the last week of December, they had one, but I don't know.
oh, I don't think I know anything about that.
That'll be done. So after, what they said is that, that both the House and the Senate are going to convene together, for that training after
Okay.
the sessions tomorrow morning, or tomorrow after sessions.
Okay. All right.